Hello everyone, my name is Anjana and we have today, as I was talking earlier to you guys, that we have Dr. B. Todd Schaefer from Nasal and Sinus Surgeon, who is here with us from ENT and Allergy Association from Lake Success location, and it's an honor to have you here, Dr. Schaefer, and thank you so much for joining with us today.
Thank you, Angela.
And I know that it's a huge pandemic going on right now, and we all have questions. We all are very scared. We are very panicked. We're getting a lot of misleading information because all we are doing is just sitting and watching news and news and news. But what we really want to know, we should do. I think that was a really good idea that you're joining with us to answer our viewers' questions who are tuning in right now. So if you have any questions, feel free to comment below and ask, because this is a good time. Dr. Schaefer, let me start with this.
Sure.
Simple question. What is coronavirus?
Thank you for having me here, first of all, Angela. I'll do my best to answer the questions as concisely as possible. Coronavirus is just a normal virus that we see with common cold. This has taken a different twist to it, and it's very similar to the SARS virus that was an epidemic but not a pan-endemic, didn't go out through the world. This is a very contagious virus, appears to be deadly, maybe more deadly than the plain influenza virus that kills thousands of Americans each year, which we don't go crazy about. We are concerned about that, but we haven't had this lockdown, so to speak, because there's no vaccine and there's no treatment for it. Whereas for that H1N1 that happened in 2009, there was a vaccine, there was Tamiflu, so this craziness didn't happen back then. Now we don't have a treatment right now. There may be treatments coming up that could actually just wipe this thing right out. There's a hope there. That's the bright light, the light at the end of the tunnel, and that will come before a vaccine. Vaccine's it takes time to vet it out, and that can take up to a year. So we do not have a vaccine for this right now. That would be helpful.
All right.
So this virus, coronavirus, Covid19 as it's been called, SARS-CoV-19, is contagious. It's started in China, and it just traveled throughout the entire world, hit Europe. Italy got hit very badly. Spain got hit very badly, and now it's entered into the United States. It took one person who possibly didn't even know they had the virus. Most people don't have any symptoms or have like a cold, because it is a coronavirus.
Right.
It's like a cold.
Okay.
So
let me ask you this.
Sure.
What are the symptoms of this virus?
Okay, so the common symptoms are fever, cough, some people may, and fatigue, body aches, which is basically any flu virus.
Okay.
So that's common, so that's where there's a lot of overlap. Sometimes you can't tell which one it is. I mean, we're at sort of the tail end of the influenza A and B infection cycle right now, but those are the most common symptoms.
Okay. So my next question is, all these questions that we are getting is before we brought you in here, and thank you again for doing this video with all of us and helping the community. I went and did a small little video saying that if anybody have any concerns and questions, this is the right time. But we will be doing this another video, maybe hopefully next week or so, as more questions come in and more concerns come in for our viewers. One other question that people do want to know: what can a person do to prevent themselves and others from getting the virus?
So I'm sure we've all heard this. The common things are hand washing. It's probably the most important thing. We're doing social distancing, 3 to 6 feet. That's why everything's being closed down now. Covering or sneeze or cough, because this is an airborne droplet infection. So if you sneeze or cough, there's a flume of viral particles. If you have the infection, flume of viral particles that could basically last on the surface for a couple hours possibly, We don't have all the answers to this, so we believe so far that's what's been mentioned. You can sit in a room maybe for a couple hours also. It's in the air, it's airborne. So if you're in that area, it's possible you can inhale, ingest those viral particles and get infected. So the person could be asymptomatic, they don't even know it, they give a little sneeze, or someone can start getting the symptoms of the virus, which is very severe. Usually it's, as I mentioned, cough. Sometimes they start with a sore throat, and it can wind up having the worst part of this would be tightness in the chest. That's when you've got to be a little bit more concerned about probably seeking medical care.
So the main important thing, as Dr. Schaefer is saying, is when we cough, it's a common sense thing that we should be doing it, not that we have to wait for this time to do it, is when you cough, make sure you cover your mouth, you sneeze, do it on your elbow, wash your hands before eating, after eating, or touching anything that you feel, and do not touch your eyes or mouth or any places that you feel that these particles can go through and inside of you and harm you in any way. So just make sure wash your hands as much as you can.
Also using the sanitizers also.
Yes. What should, if a patient is sick and they think they'll be all right, or sometimes people do get panic and they run to the doctor, what's the first step they should do when they are sick at this moment, right now?
Well, it depends on the level of sickness, okay? Because some people it just seems like a cold. There's no need to go to the doctor. Maybe you're going to self-quarantine yourself. Stay home. I mean, that's the main message. Stay home, self-quarantine. Don't be within 3 to 6 of people. Wash your hands. Cough or sneeze. Protect that. Don't touch your face. You can take Tylenol, is probably safe. Advil right now they're saying may not be as safe to take as plain Tylenol. So watch your temperature, high fever, cough, and if you're getting respiratory shortness of breath, that would be the time to really seek medical care. Okay. It's probably going to mean you're going to need to be tested.
So now people also have they're scared about coming to the doctor's offices. Here at ENT and Allergy Associates, we are here in Lake Success location. I would like to know your perspective and how the medical staff and how over here at this location that people or the staff is preparing so everybody can be safe and they can be treated what they are coming in for.
So here at ENT and Allergy, we are pre-screening our schedule. All the doctors look at their schedule, and basically we're trying to screen out patients that are 65 and older, or any patient that has underlying medical conditions that may predispose them to infections or immunocompromised. And we're going to speak to them on the phone, usually first, and see what their problems are. Maybe we can just handle it over the phone and not have them come in to be exposed, even to take the car ride over. Our office is as safe as can be. The patients are pre-screened. When they come in, they're going to get a temperature taken. If they have a fever, then we're going to have to speak to them, and maybe they're just not going to be able to be seen. We may have to direct them someplace else. We do not do the testing here in the office. So that testing is going to have to be done someplace else. Our staffs are wearing masks for the most part. I've got this special mask, which is called the N95 mask, which fits tightly. And so we're using that because I have to get close to the patient to examine their ear, nose, and throat. We have looked at going through all that, and we're trying to stay safe.
And the waiting area is not...
So we've also diminished our schedule. It's a good point. We have cut down the schedule so there's less people in the waiting room, and the wait time is less. So we're sensitive to people's needs, and the patients have come in and they've seen that it's just not as hectic as it usually was, like maybe a month ago. So we're sensitive to the patient's needs and to our staff needs. We want to make everything safe.
All right. Now, there's a phrase, social distancing and community spread. If you can elaborate a little bit on this, what does that mean and how it can be properly be...
So this virus, as mentioned, spreads through the air, droplets, sneezing, coughing, whatever. and the closer you are, the higher risk is you can get be infected. So we want to keep that distance 3 to 6 feet. That's why the bars are being closed down. Any tight quarters, like Madison Square Garden, all the sports have been canceled. They don't want big crowds. So as you notice, it started like maybe 100 people, 50 people, 10 people. Now it's like you can't have more of a crowd of 5 people in an area. So this is a serious infection potentially. It's really worse for the older and immunocompromised patients. The younger patients seem to have less chance of getting a severe infection. Some are younger. We don't know if they were vaping and then they got the infection. So there are a lot of factors that we still don't know.
All right. So basically, just protect yourself, protect your loved ones, and if it's self-isolate or stay at one place. So try to make sure to do that and just don't go out. As we were seeing the video the other day about, it's a spring break time, and there's some of the kids who are out there on the beaches and enjoying life, which I think we all would like to do it. But this time, what are your thoughts on that? People who would like to go out, who want to enjoy the beach, and it's short life, just enjoy it. What are your thoughts on that, especially to those people?
The beach could be a good place because it's open air as long as you keep your distance. But with spring break, they're not really keeping their distance. So, and they may not even be feeling sick. They can get the virus. This is not uncommon, that age group, 20 to 30. I don't want to pick on those young people. But between 20 and 30, they get the virus, but they don't have the symptoms. But they can spread it to their grandparents or parents or anyone who's immunocompromised. And unknowingly doing it, but knowingly, we know they should keep their distance and they should follow those rules.
What about the kids who are home now, who've been asking this question, why are we home? Why are we can't go to school, who cannot understand? What would you tell the parents to how to deal with those kind of questions, or to make them kids understand that what's going on?
Well, they have to try to explain to them it's very contagious infection that's occurring, and they've got to be mindful of simple things that we've all been taught about: washing our hands, covering our mouth, being careful about sneezing and coughing and sneezing into their shirt or sleeve or into a tissue, and then disposing of it properly. It's going to be a lot of video games and things like that. So this is a different world for right now.
Okay. I know there are a lot of people who are very panicked and scared to capture the moment and understanding what's going on. What would your thoughts, or what would you say to those people who are can't even go to the grocery store right now because as the governor said today that it's going to be, everything will be shut down, excluding the essential work. What would you say, even to going and buying the groceries, how much or how long should we buy it for or store it?
Well, initially there was a lot of hoarding of foods, toilet paper for some reason.
Yes.
But it appears the government has this under control, and that the grocery stores will be filled. They're producing enough, even though people are taking 2 or 3 times the amount they should. But that appears to be okay, and people are going to be able to go out to get these essential things, but then they're going to have to return to their homes and stay in. So it's not a complete lockdown. It's just not to do non-essential things, to get food and water and medications, seeing the doctor, things like that. That's going to be open, but basically you're going to be home most of the time.
All right. Well, this is it for today, and thank you so much, Dr. Schaefer, for joining us today and helping our community and understanding what is coronavirus, and should not be panicked or scared, but be informed, be knowledgeable, and obey the laws, what we are understanding, and just do what the right thing is, that because we don't even know what it is and how long it's gonna continue to do this. But if you have any questions, always feel free to comment below, and then hopefully we can schedule another maybe next week, coming week. We can bring Dr. Schaefer back here, and if you have any questions, feel free to ask him, and he will be happy to answer. So thank you so much again.
Thank you for having me.
Thank
and
you.
It is unprecedented times, but we will get through it.
We will get through it. Yes. Thank you. All right. Go.